adverse reactions. Here's how your neighbor pain.
Edith Jacobson, 11XX.
Bruises, bleeding.
Ms. Jacobson, do you have any allergies?
Not that I know of.
And are you experiencing any pain?
Yeah, my left hip.
And I'm getting ID checks out. Ms. Jacobson, today I'm just going to give you your medication. First, I would get a fresh set of vitals. Her blood pressure is 132/86, taken in her left arm. Her heart rate is 92 in regular, respirations are 12 in regular. Her O2 is 93%, and her temperature is taken tympanically, and it is 97.8. And she just stated that her pain is a 3 on a 1 to 10 scale. So I'm just looking over your orders right now, and I have a few questions for your provider.
I'd wait for that to dry.
So I would call the provider.
Let it dry.
Ring, ring. Hello, I'm with Edith Jacobson. She's an 85-year-old female, 105 pounds, and 152 centimeters. She's in for a left intertrochanteric hip fracture. I have a question about her enoxaparin. You have 30 milligrams now, sub-Q, and Q12 until surgery tomorrow. The recommended is 40 pre-op. What would you like to do?
Good catch. Go ahead and administer 40 milligrams sub-Q, Q12 prior to surgery tomorrow evening.
Alright, and then also morphine sulfate. Morphine sulfate is contraindicated in enoxaparin. So morphine sulfate IM is contraindicated in enoxaparin, so what would you like me to do for that? And also, I need a frequency and a reason.
Since we don't have PO available, go ahead and administer 5 milligrams IM of the morphine sulfate, PRN, Q4 to 6 for pain.
Alright, I will administer the 40 milligrams sub-Q of enoxaparin and the 5 milligrams IM of morphine sulfate. Thank you.
I'd also consult to see if potassium supplements.
Alright, so for her pre-assessment, I already checked her vitals. I would have a blood panel started so I can compare and get her baseline. And I've already asked her if she's allergic or if she has any hypersensitivity to the drugs. She's not, so I'll continue with getting her medicine ready. Okay, I'm going to start with the enoxaparin.
Urinating a lot, cramps, headache, hypokalemia.
Going to clean the top with an alcohol wipe.
Photosensitivity. So later when we discharge you, just wear sunscreen, okay?
I'm going to be giving 0.4 mils.
So if you need any licorice, I'm so sorry, Ms. Jacobson, but you can't have any alcohol.
And then I'm going to inject that air into the vial, invert, and then withdraw the medication.
So I'm going to give this to you on your right vastus lateralis area, right in the muscle. So I am, wait, no, it's your pill.
Okay.
Sit her up.
Here I have
She has a broken hip, which contraindicates
0.4 mils of the enoxaparin sodium.
assist her in swallowing. Check her mouth to make sure it's not.
And then this is a sub-Q injection, so I would put it in her left lower quadrant of her abdomen. Clean in circles going in to out.
For the morphine, I'd also listen to your lung sound.
And then I would inject 10 seconds per mil, so. Alright, I would put in my safety shield and put that in my sharps container. Then I'm going to prepare my morphine. Today I'm going to be giving her 0.5 mils. Clean the top.
I just felt really uncomfortable just seeing that right there.
And this is a 3 ml syringe, and I'll be giving her 0.5.
We didn't change the dosage.
Okay, so what I need to tell you is we're going to give you this every 4 hours as needed for coordination. So adverse effects, you could be drowsy, you could have a slow heart rate, your blood pressure could go up or down, you can get nauseous, you can vomit, you can get constipated, you can have abdominal pain, you can have difficulty sleeping, and pain at injection site. So we're really going to be monitoring your breathing.
Okay, I have 0.5 mils of morphine. And then this is an IM injection, so I would be giving this in her vastus lateralis or her ventrogluteal. Clean the site.
Reagan, how do you get the safety needle down?
And then
I was so afraid that was going to take a while.
I'll inject it. And then I would use the Z-Track banner for an IM injection, and I would keep the needle in for 10 seconds. And then do my safety, discard that needle, and I would put a piece of gauze or a Band-Aid over that site if needed. Last is 12.5 milligram tablet of hydrochlorothiazide. Put this in her pill cup, and then I would offer her a cup of water too. I would raise the head of the bed, give this to her, and then make sure that she takes it. So I would check in her mouth and under her tongue and make sure that she did indeed take the medicine.
I'd go back and after.
And then so for my post-assessment, I would teach the patient that she needs to instruct her provider if she has bleeding or abnormal bruising, and that she needs to talk to her physician before taking over-the-counter drugs or any herbal therapy. She also needs to avoid alcohol and other opioids, and then alert her doctor if she has slow or difficult breathing or if she becomes lightheaded. Report all medicines being taken so that there are no contraindications. And I would teach her about incentive spirometry for the morphine. And then for her hydrochlorothiazide, I would tell her that if she's taking it home, that she needs to take it with a meal in the morning so that her stomach doesn't get upset, and she's taking it in the morning so she doesn't have to get up in the middle of the night and use the restroom. And to avoid licorice and alcohol, and to use sunblock when outside. And then for my post-assessment, I would go back in a few hours later and monitor her blood pressure and heart rate and her respirations. I would check the injection site and make sure there's no redness or swelling. I would keep her platelet count monitored so I can compare that to the baseline that was taken in the pre-assessment. I would check her pain scale from before after giving her the morphine. I would check about 30 minutes later to see if it's been effective or not. And that is it. I would then lower the bed and make sure she's comfortable. You can do anything, your call light's right here. Thank you for letting me take care of you.